So the first thing that many people after cancer treatment have to deal with is body image. You know, we are sort of all raised to think that we should be thin and gorgeous and muscular and beautiful, and that anything less than that is not good enough. They are pretty cute. He is pretty cute.
But they wouldn't look good together. I mean, she's so damn skinny. Like, he looks fine, but it's...
I know, she looks ridiculous.
Yeah.
Yeah. So she's a caricature, you know, and he's our ideal. So, you know, after cancer, people have to become intimate and get used to being somewhat different, but it certainly is possible and can be just as satisfying and lovely. But there are changes in body image. So this is a woman after breast cancer. And this is a man after bladder cancer, where, you know, men have a bag on women too, but this is just a male body. That has to be adapted to. And so people have to sort of realize that there is a change and that they have feelings about change. You know, Sheila talked earlier about letting yourself feel about the feelings that you have about the changes. Absolutely important, absolutely necessary, and not at all awful in the long run, because if people can share how they feel, including the disappointments, that can lead to closeness, because only when people acknowledge, and when a person acknowledges what's changed and how they feel about it, can they move towards acceptance. Ignoring things rarely works. So the work that needs to be done is to acknowledge those feelings, accept them, and start to think of oneself in a new way in the sexual partnership that includes that change in one's body image. And it may be that there need to be some new things that have to be incorporated into the sexual activity that were not there before, but they sort of compensate for what has been lost or what has changed. Now I wanted to show you this slide because this is from our database in urology. Patients who had their bladders removed, and half of them had new bladders built, and other half had an ostomy, you know, a bag. And they both have different kinds of problems. With the neobladder, the new bladder, there's urinary leakage, and with the ostomy, there's a big change in body image. And what was found was, so these are, you know, this is up to 100 months after the operation. And the results are valid to about here, because after this, there are not enough patients to make this very valid. But the lower this number, the better body image. And so what they found was, what is in our database is that people after these operations, while they've had to adapt their image of themselves, their body image, they all have a pretty good body image, all of them. So that was really kind of a nice finding that people can do that. Okay, so let's review what are some of the problems that people experience. Loss of libido, vaginal dryness and pain with intercourse for women, erectile dysfunction for men sometimes, and generally some sort of level of worry about how it's going to go, or whether the partner can be satisfied, or whether it's going to work well again. So what can we do to help ourselves in that situation? So this is, for example, bodywear that was developed for people who have ostomies. So it's bodywear that covers that area and still permits sexual activity. Comes in different colors. So for women who have had treatment that has resulted in vaginal shortening, in dryness, lack of lubrication, and then potential pain with intercourse, it's important to maintain what we call vaginal health, which is, first of all, regular sexual stimulation. Why? Other than the sexual pleasure that can come from that, that brings blood into the tissues in the perineal region. So regular stimulation of the perineal area, either by oneself or with a vibrator, is actually health promoting to those tissues. Then it's very helpful to have regular penetration or stretching, which can be done again either through intercourse or through dilators, and I have a picture of that, or with vibrators. But vaginas, just like penises, very sensitive tissues. If you don't use them, they start shrinking. So it's important to do something about it with or without a partner. It doesn't matter, because we are kind of all responsible for our own bodies. So if you think you now don't have a partner, but maybe you'll have a partner in 3 years, important to maintain the health of the vaginal tissues. So it's important to regularly moisturize them with lubricants. And sometimes it's good to use topical estrogens. Now, obviously, that's probably not for women whose cancer is estrogen sensitive. But I was speaking to a bladder cancer support group not so long ago, and there is this topical estrogen called Vagifem, which is a suppository that sort of is inserted like a Tampax. It's just tiny. And so I contacted the urologist and I said, would it be dangerous to the women? And they said no, because bladder cancer is not associated with estrogens or with any hormones, so that would be fine. So that is something that everybody has to find out from their own physician, but there are things that can be done to keep the vaginal walls plumped up and moist and lubricating. Kegel exercises are probably familiar to women who've had babies, because those are exercises that strengthen the pelvic floor. They are good exercises for toning the muscles in the perineum, toning the muscles around the vagina, toning the muscles that support erections, toning the muscles that help with urinary incontinence. So Kegel exercises are just a great thing for everybody.